So speaking of the feet, we have a couple listeners. I guess many people are at work today, and there's a listener named Rochelle. If I'm saying that correctly. She would like you to expound on neuropathy pain.
Mm-hmm.
And how does one get it, and what's the best cure for it, and what do you foresee that one needs to do when they have that?
Well, first of all, you got to know why they have neuropathy. So that's your first question. So there's probably 30 different reasons why you can have neuropathy. Number one is diabetes. Number two is usually some kind of bulging nerve, pinched nerve in your lower back, or arthritis, previous spinal surgeries. You can have it from chemo. You can have it from having HIV, from being an alcoholic, low B vitamins, and then other medications. So first is finding out why you have neuropathy. Then the discussion is, what do you want to treat your neuropathy? So there's vitamins, there's creams, there's patches, there's drugs. So it depends. There's spinal stimulators. So it depends on how severe your neuropathy is. And then when you talk about drugs like gabapentin and Lyrica, then we have to talk about your kidneys, because those drugs are cleared by your kidneys. So then we have to discuss, do you have kidney function issues? Because if you do, then you have to go through a nephrologist, or you have to go through your primary care doctor who's monitoring your kidneys. And then it's also the severity of the neuropathy. So if it's mild, we talk more like vitamins, there's topical creams, there's patches. Then there's newer patches like Cutenza, who's made with capsaicin, but a very high dose of capsaicin. So that's applied in the office every 3 months. And that's covered by some insurance plans. So it just depends on why, who, what, when, where, why, and what the patient wants to do. Do they want a drug? Do they want a patch? Do they want a cream? Do they want a vitamin? And then the severity of it. Because when you talk about drugs, then you're talking about side effects. So it's not a simple conversation.
Okay. And we know some things can get a little complicated, and they